Hello everybody, my name is Manidora and welcome back to lesson 3 of Dentistry 101. Today we are going to be going over oral hygiene and preventative care. As always, if you would like to take notes, be sure to take out a notebook as there's a lot to go through, and always sit back, relax, and enjoy the show. However, before doing so, I strongly recommend and advise as required to take a look at the disclaimer before uh, acting upon anything on the slideshow. And yeah, let's just get into it. Now, why oral health matters. So, firstly, my image source for this is my local dentist NorthMed or sfdental.com. So, essentially, oral health matters because oral health equals to overall health. So, now when we look at this image, here's some things to show you why general health and oral health are inevitably connected. So, firstly, diabetes and gum disease. So, gum disease accelerates the progress of full-blown diabetes, which of course, food going through your digestive system and oral cavity will obviously hurt you. Then mouth bacteria and heart disease. People with gum disease are more likely to experience heart disease than those who don't have. And then teeth grinding and stress. So I'll go and into that later. But stressed and depressed people are at a higher risk of dental problems, which I will go into later. And then pregnancy and gum disease. Pregnant women with gum disease are more likely to have small or premature babies. And then disease and tooth loss. Adults without teeth are more likely to suffer chloric kidney disorder. Then finally, anemia and pale gums. Anemic people usually have sore and pale mouth. Their tongues become swollen or smooth, a condition called glossitis. So next time you do your daily oral care routine, always remember that a healthy mouth signifies a healthy body, which is why they're perfectly interconnected. So maybe this isn't something you take a note on, but just rather kind of understand the concept and maybe get the application of it. Now, going on to the next slide, preventative dentistry. So the aim of preventative dentistry is to obtain optimal oral health. You do so by doing the following: visiting your dentist for routine care, brushing and flossing daily to remove plaque and or bacteria that grows on the surface, following a good exercise routine and nutrition program. Apologies for the typo there. And then following a fluoride plan with while teeth are developing to ensure strong growth and to prevent decay. So now we can see the functions of fluoride, which is 1, hardens our teeth enamel, 2, prevents our teeth from dental caries, and then 3, stabilizes the structure of our bone. So my image source for this is the eufic.org. So now you kind of get what fluoride does, and then how it connects to preventative dentistry and what that is to begin with. Now, brushing your teeth. So my first of all, as this slide kind of goes off the image, I'd like to cite that I got this from Healthline.com. So now going through it, the simplest way to brush your teeth involves your standard plastic handled nylon Bristol toothbrush, and I'll go more into the types of toothbrush later as well. The entire process should take about 2 minutes. So first you lubricate your brush with a small amount of water and then put a small amount of toothpaste, about the size of a pea for reference, on the head of the toothbrush, or like the very top of it. And then 2, you insert the toothbrush in your mouth at about a 45-degree angle to your gums and use gentle, short circular strokes to brush your front teeth. Then you brush the outside surfaces of your teeth. Make sure to get the back molars and upper areas of your chewing surface. So we can kind of see the diagram of that here in step 3. And then step 4, we flip the toothbrush upside down to get the inside surface of our top front teeth. Flip it back around to get the inside surface of our bottom front teeth as well. As all the food that we eat can get stuck in anywhere around our teeth, and we don't want plaque buildup to happen either. And then 5, brush your toothbrush to get rid of any bacteria buildup or plaque that has gotten stuck there during the brushing process. You can also use a cup of water there. As we can see in step 6, to spit out the remnants of toothpaste, saliva, and water into a clean sink. Finish by rinsing your mouth with cold water to get rid of all bacteria or whatever was just loosened by the toothbrush. And that takes approximately 2 minutes, the entire process. So the main thing to understand is where exactly where to brush your teeth and at what angle to do it at, which is 45-degree angle in smooth circular motion and short circular strokes. Doing this using short circular strokes have been found to be the most effective when brushing your teeth as well. If you were to do some research on that as well, which I won't really go into right now. Now, electric versus standard toothbrush. So what's the debate like? So my source for this is Orthodontics Australia, and now on the left we can see the electric toothbrush. So its power rotation helps loosen plaque. It's great for people with arthritis or other conditions that lead to limited dexterity. It's popular with children who think the electric toothbrush are more fun to use. It comes with variable speeds to help reduce pressure on sensitive teeth and gums. And this timer ensures you brush each section of your mouth for the right amount of time. And the head needs to be changed every 3 months. And now the standard toothbrush. It can help people feel like they have more control when brushing their teeth, the greater ability to reduce the pressure applied to sensitive teeth and gums, and it's small and convenient for packing when traveling. However, with today's technology, we can also see electric toothbrushes also getting smaller and easier to use with better battery lives. And the main thing is it's cheaper and easier to replace than the electric toothbrush. So electric toothbrush you also have to replace at some point. It costs approximately, if you were to search up, it could go from like anywhere from like it can go up to like $100, right? And then the standard toothbrush you can usually find for like $1 or $2, and maybe even your dentist could give you some for free at every checkup. So it's a major cost factor as well. And then the brush entirely needs to be replaced every 3 months. So that's also one thing to keep note of. So either way, if you use an electric toothbrush or standard toothbrush, the head would always have to be replaced. But the difference with the electric toothbrushes, the head is you just have to replace the head, not the entire thing. But for the standard toothbrush, you must replace the entire thing. Now, flossing. So why we floss? So my source for this quote is the Australia Dental Lab again. So flossing cleans between the teeth where brushing can't reach. The goal is to disrupt the formation of dental plaque before it calcifies to form calculus. So now if we look at this image which I got from advancedsmile.dental, how do we use dental floss? So firstly, plaque likes to grow between our teeth and under our gums, which causes dental problems. And then dental floss removes the plaque growing between your teeth and under your gums. So we hold it by wrapping around 2 feet of floss around the middle finger of each hand, or make a loop by tying the ends together. We use our thumb and index finger to guide the floss between our upper teeth, and to clean the lower teeth, slip the floss down with your index finger. So now flossing. So going one by one, work the floss gently between your teeth. Bend the floss around the teeth in a U shape and pull the floss against the tooth. Move the floss gently under the gum until you feel the pressure, and hold the floss firmly against your tooth and scrape the plaque from the sides of your tooth in one pull. So be sure to floss both sides of each tooth and make sure to move to a clean area of floss after every 2 or 3 teeth. So flossing is essential because there's some places in our teeth that our brush can't get to. They're very tiny, like tight areas. So that's why the floss is needed and is completely necessary to avoid plaque buildup, which I will go into later as well. Now, plaque. So plaque is sticky masses of bacteria that grows on the surface of our tooth. It happens when you miss some areas when brushing or flossing, and then small white sticky masses form on our tooth. So the bacteria, and it can also be yellow as we see in this diagram, and as yellow in this diagram. So the bacteria in the plaque is fed on by sugar in the food we eat. The bacteria fed by that sugar then turns acidic, which can cause demineralization on your teeth. The minerals such as calcium, phosphate, and other minerals embed in the enamel. So we regain these minerals in our enamel by remineralization. This is what happens when minerals are replaced, which can be done by a dentist if they think the plaque is getting worse and can cause later issues in your gum and teeth. Then my source for this just image or basic image is what is dental plaque. And then we can see this tool being used just to clean the teeth. Now, let's go into the decay equation. So this is something you learn in dental school as well, and it's quite simple. So sugar and bacteria from the plaque equals to acid, which is why dentists highly recommend not reducing sugar intake. And then that acid with a healthy tooth creates decay. So that's essentially this decay equation with food you eat, sugar, and bacteria from the plaque equals to acid, which is then added to a healthy tooth, which equals to decay. So my image source for this is carrypediatricdentistry.com. Now, foods to eat or slash avoid for your dental health. So my image source for this is the savannahsmiledesigns.com. So some good foods include strawberry, which contains malic acids, a neutral enamel whitener, spinach and leafy greens, which scrub your teeth as you chew them, essentially. Cheese, which is a good source for enamel strengthening calcium. However, we don't recommend too much cheese and recommend as it's not good for you. And then water, drinking plenty of water helps flush sugar and acid off your teeth, which also contains fluoride, which protects against teeth erosion. Apples and pears, which scrunch away plaque and freshens breath, while raw pears neutralize acids in your mouth. Celery, which is loaded with fibrous strands and is the nature's floss, stimulating saliva production. Finally, sugar-free gum, which can stimulate saliva production and washes away acids produced by bacteria in your mouth. However, this is only for sugar-free gum. As we talked about before in the decay equation, sugar is poor for your teeth and can cause decay later on. Now, coffee. Now, the worst part of foods, coffee. It's acidic and can stain teeth even more severely than tobacco. Soda, which is regular and diet soda consumption, have been linked with tooth erosion and decay. Wine, which in acids in both red and white wine, which is both erosive, allows stains to deeply penetrate teeth. Hard and chewy candy, which saturate your mouth with sugars over several minutes, giving bacteria plenty of time to proliferate. And finally, citrus fruits and juices. So they're healthy and nutritious, but their highly acidic content can erode tooth enamel over time. So be sure to drink plenty of water after eating citrus fruits to help lessen negative effects. Now, dental sealants. So this quotes from the Center of Disease Control and Prevention. So it's a thin coating that, when painted on the chewing surface on the back of your tooth, can prevent cavity for many years, or molars and tooth decay. So it protects against 80% of cavities for 2 years and then continues to protect against 50% of cavities for up to 4 years. So according to Humana.com, it costs roughly $30 to $40 a tooth without insurance, so it is a bit pricey, but it is worth it in the end, as you have minimal risk of cavities or tooth issues. And it's painless and takes only a few minutes per tooth to apply. So it's, if you were to do all 32 teeth, it could take some time, but it is essential. It is in the end worth it. And this is kind of the diagram and steps for the dental sealants, and I have the same source from the Center of Disease Control and Prevention as the last slide. So first, etching solution is applied, then the tooth is cleaned and dried, then the sealant is applied, and using light or air, sealants take a few minutes to dry, and then we have the tooth with the file sealant. So it's quite a simple process, but it may take time as there's a lot of teeth to go through, 32 to be precise. Now, oral care for children. As it's a bit different for children, I kind of want to go through the steps, as we may be in the age of teens and beyond for most of us. So from birth, you have to make sure your baby has a good nutritious diet to ensure good teeth development and prevent cavities. And then throughout infancy, rub baby's gums clean daily with a wet piece of soft gauze or damp washcloth within a few days of birth. And then from your baby's first tooth, it means it's time for your baby's first annual dental visit, as they poke between 6 to 12 months. And then through age 2, to prevent teeth from tipping forward or going in crooked, weave and pacifier use no longer than 2 years. And then from the toddler years, brush a child's teeth with a child-sized brush and smear of fluoride toothpaste. And then from your early childhood, have children brush with a pea-sized dollop of fluoride toothpaste 2 times a day and visit a dentistry 2 times a year. And this should be under parent supervision, as of course, as a young age. And then throughout childhood, including today, avoid using utensils, forks and spokes, cups and straws with your children to prevent the spread of bacteria that causes cavities. And then from adolescence, as soon as permanent molars come in, children can have sealants applied to prevent tooth decay and can be reapplied every 10 years. So I think we talked about those here, dental sealants. And then teens and beyond, so that likely us. Unless your dentist recommends otherwise, continue taking teens to twice a year for checkups for a lifetime of good dental habits and savings. And then my image source for this is Shadow Creek Ranch Dental Specialists. And then you can just take a minute to note this down when we get the concept. Now, gum disease, or periodontitis or periodontal disease. So it's caused by poor brushing and flossing techniques and allows plaque to build up on the teeth and harden. And almost half of all adults in the US have some form of it. If you have gum disease, some symptoms can include bleeding, soreness, bad breath, and painful chewing. So my source for this is Cleveland Clinic. And maybe you can just take a minute to note this down, as it's important. We don't want this one day, right? Almost half of all adults in the US have some form of it, and most of them don't even know they have it. Now, the 4 stages of gum disease. So first we have gingivitis, which is the inflammation of the gingiva or the gums and bone loss. 2, we have mild or earlier periodontitis, which is the inflammation of the gingiva and the surrounding tissues that results in early bone loss. 3, we have moderate periodontitis, which is the inflammation of the gingiva and the surrounding tissues that result in moderate bone loss. And then finally, we have advanced periodontitis, so the inflammation of the gingiva or gums and the surrounding tissues that result in severe bone loss. So my source here is Dr. Deanna Sedler from the cuttingedgeperiodontists.com. Now, stress on oral health. So taking stress can also have poor effects on your oral health, including grinding on your teeth, also called bruxism, which causes damage to your teeth and enamel, gum disease by lowering your immune system, and then tooth decay by unhealthy food choices you eat, maybe while having stress. So as your and then my source for this is yourdentalhealth.ca, the prevention and of stress and oral health. Now, the fun facts about some dentists in the USA. So, firstly, dentistry is one of the top jobs in the USA. According to orthodontics.com, it's one of the it's the ninth best job in the US to have right now. As the scorecard for dentistry sees, it's claiming lots of points for its great salary and for the booming dentistry job market. Its unemployment rate is only 0.2% for qualified dentists, and making it a top career choice. A second fun fact is by 2028 there will be 10,400 new dentists by 2028. Dentistry is a growing field with more and more dentists picking up a dental drill for the first time. According to figures from the Bureau of Labor Statistics, in just 7 years there will be an extra 10,400 new dentists in the USA, an employment growth of 7.6%. This rise will be boosted by changes in healthcare laws, a rise in population, and the retirement of dentists who underwent their training throughout the 60s and 70s. And then one more crazy fact is 80% of dentists go into private practice. And that means you can own your own practice. That's demanding, challenging, and rewarding. And then one more fun fact is that 80% of dentists practice general dentistry. So only 20% of dentists have a specialty that is recognized by the American Dental Association, or the ADA. The majority practice general dentistry and work on maintaining the overall oral health of their patients. However, this is typically due to the extra time it may take on top of becoming a general dentist. As I spoke before in the careers part, becoming doing a specialty can take more over up to 6 years extra. However, it's all very rewarding, and there's this increase of salaries, there's more job demand, etc. Now, in conclusion, that summarizes the lesson 3 of oral health, hygiene, and preventative care. I hope you guys enjoyed. Be sure to look at the disclaimer, and hope you guys are excited for lesson number 4. As always, if you are interested in more lessons, be sure to check out the other options we have in Medical 101 as well. And I hope you enjoyed this lesson of Dentistry 101. Thank you.